Hello and welcome to another live session of Northeast Today. I'm Deboshri, and today we have with us a very special doctor, a doctor of many degrees, Dr. Gaurav Deka. Born and brought up in Guwahati, he's currently practicing in New Delhi. He studied in abroad, and he's not only a psychodynamic psychotherapist but also a trauma resolution expert, a family constellation facilitator, a trauma resolution expert, and also an expert in TEDx speaker. We'd like now to give a brief introduction to our guest, Dr. Gaurav Deka. Welcome to the show, Gaurav. It's so great to have you on our show.
Thank you, Deboshri, for inviting. And I'm greatly thankful to Northeast Today for inviting me to this interview. And I'm really glad that I'm able to speak to you, speak to all the people who are in there watching us right now. Thank you.
Yeah, it's so nice to see people from the Northeast doing so well abroad. And you're soon to present your paper in Berlin too, right?
I did it already. It happened quite some time back. Yes.
Okay, that's so great. Okay, so Gaurav, we would like to show our viewers a brief introduction, brief video, introductory video of yours. And would that be okay?
Yeah, absolutely. Please go ahead.
Okay, let's show that video to our viewers.
Dr. Gaurav Deka is a medical doctor, a psychodynamic psychotherapist, trauma resolution expert, a family constellation facilitator, and a transpersonal regression expert. Dr. Deka, who currently lives and practices in New Delhi, was born and raised in Guwahati, Assam, from the northeast part of India. He holds the bachelor's degree in medicine (MBBS) from Guwahati Medical College and Hospital. Master's in Psychodynamic Psychotherapy from Boston University, US, to postgraduate diplomas in Transpersonal Regression Therapy and Inner Child Integration Therapy, respectively. Dr. Deka works with several issues that young people and adults deal with today, like addiction, depression, generalized anxiety disorder, fear and phobia, stress disorders, allergies, neuriasis, relationship issues, sexuality and orientation issues, and psychosomatic ailments. He also works with patients suffering from cancer, autoimmune diseases like hypothyroidism, diabetes mellitus, chronic kidney diseases, osteoarthritis, fibromyalgia, unexplained somatic pain, etc. Not only this, but Dr. Deka has also been very vocal about fighting for the rights of the LGBT community. He has extensively emphasized the importance of LGBT mental health and helped several patients and clients from the community with coming out. Dr. Deka has also attended TEDx and TEDx CVS events where he talked about how believing in a single identity doesn't allow us to be anything apart from what we make ourselves believe we are, and hence people never end up living the life they want to live. He believes one should first decide what kind of life he or she wants, and then once that is decided, one can very well figure out what are their identities what one can pursue in order to have that life. In another event, he emphasized the illusion of choice and how choice exists because of options and how conflict in turn arises out of options. According to him, conflict is an omnipresent phenomenon playing a catalytic role in every decision a person makes.
Wow, that was a great video. It's so inspirational watching that.
Thank you so much. Even I enjoyed watching it. Thank you.
That was great. You sure do have a lot of degrees that you have studied about. That was really great. And moving to our Q&A round, most people are aware about what a psychotherapist, more or less, they know about what a psychotherapist or a trauma resolution expert is. But what is a transpersonal regression therapist? That is a term we most often don't hear about.
Yeah. So I'll just break down the words for you. So when we talk about transpersonal, trans means beyond. Personal is the ego, which is this person who I am today, the I, right? Regression means going back in time. So every problem that we encounter in life, whether it's a disease, an ailment, a relationship issue, has its root somewhere in the past. So when we go beyond this identity of ours, for example, let's say someone is 35 years old and the problem that they are going through is probably located back in their childhood when they were 3 years old, 4 years old, or maybe in the history of their mom and dad, then we have to go back in time. In regression therapy, we take people back in time to those spaces where the root of the problem began. And that's why we call it transpersonal regression therapy, because we go back in time beyond the ego.
Okay. Okay. So you are actually taking a patient back in time, like those movies that we see. Like, so is it sort of like hypnosis or something?
So I would say hypnosis is one of the bridges people use
Okay.
to go back in time. It's a bridge, right? But you can have many such bridges. Hypnosis is not the only way. There are bridges like somatic bridge. For example,
Mm.
let's say you're moving on the road and
Yeah.
suddenly you smell a restaurant nearby and you feel and you smell the smell of dosa maybe, and suddenly that
Okay.
smell, even without allowing you to think, will take you back to maybe class 4 when you were a small child, and maybe you went out with mom to eat dosa to a restaurant. You are immediately
Okay.
regressed using a stimulus, right? So that's regression.
Yeah.
We are in regression all the time. Hypnosis is just one of the ways to go and get there, excavate there.
Okay. And in your TED Talks, you had mentioned like how you wanted to be a medical doctor at first, but that later changed into something else. Your field of study
Yeah,
is also very rare. You have past lives too. So
yeah.
would you say you took the less traveled by, as Robert Frost would put it?
I, I am a huge believer of purpose. I believe people have to not only find their purpose, but also people must believe in the inner voice which guides them to their purpose. So I went ahead and I studied medicine. And post that, I wanted to work with the minds of people. I wanted to work in the spectrum of mental health. But then I saw that, when if I go ahead and continue with medicine or I study psychiatry, my job will probably be spending, let's say, 5 minutes at the max with a certain patient. And maybe by that time, I I had believed that I can go beyond the pharmacology and beyond the chemistry of treating people. And I wanted to understand them from a developmental perspective, from a personal perspective, from an intimate perspective. And that took me to a journey of understanding the human development, human family, human mind. And I believe that's when I started studying trauma. And that became the main spectrum where I would spend the last decade. So that's what happened.
Okay. Okay, and breaking taboo, you have openly spoken about how you were diagnosed with clinical depression and OCD, which we know as obsessive compulsive disorder. Yes.
Yeah,
So,
yeah,
if it's
yeah,
okay with you, share with our viewers like what helped you get through those difficult times, because it's very difficult for people to admit that yes, they are suffering from depression and yes, they need help and they want to come out of
yeah,
those terrible times.
yeah. For the longest time, I took medication. I had a psychiatrist. I had my professors helping me out. But that did not solve my problem fully because it helped me calm down. It helped me sometimes numb out. It helped me sometimes to function well in my body. But it did not allow me to go to the root of why was I going through this at this age? What is it about me and my life and my development and my childhood that allowed me to get into this state where I just I can't seem to get out? Um, and as I traveled to a lot of places. I found because when you grow up in Guwahati, you don't come across a term like therapy, right? You don't meet people who have understanding of human development or who know what therapy is, who know what trauma is.
Yeah.
So as I traveled, I found people who taught me a lot about trauma, people who told me that there are things in childhood that happen and it affects the nervous system, it affects the body, it affects the developmental stages. And I was fortunate enough to meet a lot of people who taught me about trauma, taught me about therapy, taught me about body awareness, um, told me, took me to the world of spiritual realm where they try to show me my problems even from a spiritual perspective. And I think that all of those things came together and made sense. And it is actually therapy, um, understanding of trauma, um, body awareness, and spirituality that came together to save me fully. And it is because of that I find today myself here.
Oh, that's so great that you had people to help you out through this painful experience. But also, there are a lot of people who, they don't want to accept that they are going through depression or don't seek help. So it's very difficult
Yeah.
for those people. So, do you suggest that anybody who's going through depression or anxiety should seek the help of a counselor?
Absolutely. See, the first thing that's missing, let's say, I would say the whole of India, and not just Northeast, is the awareness that um, it always begins with expressing. It always begins with acknowledging what you're going through. So if you're going through a painful experience, you first of all have to acknowledge it. Then you will be ready to unravel, travel into the past, go into regression, and then find it out and then release it. However, we are stuck in the awareness phase itself. A lot of people are not aware. They don't know how these things function. They don't know what happens in therapy. They don't know that just by talking can we solve our problem. So, so it first has to begin with expression. And of course, I would ask each and every person, whether they are going through a mental health issue or not, must go to therapy. Buenos Aires is the only country in the entire world where every single person in the country goes for therapy.
Is that so? I didn't know that. That's so great.
Yeah, yeah. So, yeah, someday I believe that we will reach that stage in India as well.
Okay. While we are on the topic of depression, why do you think millennial depression is on the rise? Like the Generation Z, the 90s kids, we see a lot of depressed
Yeah,
people of our age group.
yeah, yeah. Um, it's a long answer, but I'll try to shorten it as much as possible. Um, so you see, the world is changing too fast right now. When people ask me, Gaurav, you talk so much about trauma. What exactly is trauma? And I tell
Hmm.
them that trauma is anything that happens very fast to you, so fast that your brain cannot process. And
Hmm.
your body is in this flight, fight, or freeze mode. So most of the time you're in freeze mode and you are just hyper functioning. You become hyper aware, you become hypercritical, you become hyper vigilant, and your body is always trying to find out that if there is a threat outside of your body that you must manage. Now, when we look at information that's coming to us, everything about life is so fast, be it social media, be it, getting up in the morning and then suddenly running for your job, or, opening your laptop and typing away because you have to type 100 emails in a day. Every single thing is fast. At the click of a button, there is a car waiting for you outside, right? Because you have apps. At the click of a button, there is food waiting for you outside. So it's not just the concept of instant gratification, but it's also this concept of the world is too fast for our nervous system, for our bodies right now. As a result of which our aspirations, our desires are also fast. We want to have everything in one go, right? So there is a sense of emotional gluttony that we want to have. As a result of which, at the end of the day, we feel that there is nothing left. There is always a void. That's the reason why we find so many people scrolling mindlessly through social media all the time. Why does it happen? Because it's too much to stay with your own emotions. People are not aware of their emotions because everything is too fast to be processed right now. And that's the case with millennials right now, right? Because the world and the life is just so fast. we don't have time to slow down.
Also, okay, Gaurav, if it's okay with you, we would like to show our viewers few of your pictures that we researched and found on your social media profiles. Will that be fine with you?
Absolutely. Go ahead. Thank you.
So I'd request our technical team to show you had a picture with Sohali Khan taken. Yes, you're
Yes.
receiving an award through Sohali
Yeah.
Khan. I'd like a technical team to show that picture, please.
Yes. Yes.
I think there's a technical issue. I was asking for the picture of Suhali Khan, where you were receiving an award from her. Okay, tell us about that brief photo, though.
Yeah, it was India Leadership Awards that I was receiving, and I think it was way back in 2008. I don't quite remember the date, but then, um, yeah, it was an award for being the best regression therapist, and also because in India we don't have a lot of people working in the field of regression work. Um, in fact, in the beginning, it was thought to be sort of a taboo to work in regression because it was also a modality that used understanding of the human mind from a spiritual perspective as well. And many people said that it's not backed by science and all of that. However, with recent advances, we know now that the body stores all the memory right from the time it is conceived in the mother's womb till the time it dies. So the body is also in a constant state of regression. So when we go back to regression therapy, we know that we are going back to memories that the human brain probably cannot decode, but the body knows that the memory is inside it. And now it is, of course, backed by science. So I'm very happy to proudly claim that I happen to be a regression therapist, and this award was on that for being a regression therapist in India, the best regression
We
therapist
were
in
talking.
India, I would say. Yeah.
This is the photo we were talking about earlier, right?
Yes. Yes. Absolutely. Yes.
How was it meeting Suhali Khan?
Oh, it was wonderful. She's a lovely person, and I had a really good time conversing with her.
Oh, that's so amazing. I want to meet her someday as well. Okay, and the technical team was just showing a picture, another picture of you on the podium receiving an award, yes?
Yeah, I think it's the same one. I think it's the same one. Yeah,
Okay,
it's
all
2000
right, right.
India Leadership
And
Awards. Yes.
okay, the leadership awards. That too from Sohali Khan. Oh my God, congrats. Like, congratulations.
Thank you.
And, you know, yeah. Okay, so Gaurav, moving on to our, I'd like to move on to our next question.
Hmm. Hmm.
Over there, pictures are so nice to see. And, you knew your calling after your ups and downs in medical school. But a lot of
Yeah.
young people, young kids, is after their school, when they have to choose a path, they have a struggle finding that. So, what's your hack or mantra?
I think this is this is like a rite of passage. Um, in order to find our true purpose and what we truly want in life to be, we have to be
Mhm.
willing to look at things we truly love, things that come to us with a lot of
Mhm.
ease, things that do not bring anxiety to us, things that you don't have to work 24 hours every single day to develop the skill. For example, I'll give you an example, and I spoke about it in
Okay.
my first TEDx talk as well. For example, when I was in med school, then a
Hmm.
lot of people, they wanted to become surgeons, and these people did brilliantly well in subjects like microbiology, pathology, or prevent social medicine, but they only wanted to become surgeons. And the reason that they gave me was, to be a surgeon is something that we can be these big people in the society. We can have status, and we can have the name of a doctor, and it feels good to be a doctor with a stethoscope hanging around your neck if you are a surgeon. However, because microbiology or let's say pathology may not be completely clinical subjects, therefore we won't want to be there even if we are good at. I say the opposite, that whatever you are good at, whatever comes easily to you, whatever you doesn't kill you in developing your skills, everything that comes easily to you, go for that, right? If it means making, let's say, a video on YouTube, if it means dancing ballet, if it means working out and you want to be, let's say, a body expert or a body trainer, do what comes easy to you instead of trying to beat yourself up, learning for 10 long years, developing a skill that you don't like, or um, that is going to take away half of your life. Do what you enjoy.
Also,
And
that
people can't
happens
do
a
that
lot.
because they're so scared.
Yeah, right.
Sorry.
Also, don't you think that happens a lot due to parental pressure as well? And what would be your message to, Indian parents who are obsessed with their children becoming either doctor or engineer or, taking an MBA degree? There are a lot of parents, like, and luckily I had very lucky
Yeah.
parents, but I had have friends whose parents used to be very, they used to put a lot of pressure on their children about medical degrees or engineering degrees. So what would be your message to them?
Observe the child. Observe your child. Your child is a magical being. They display their talents, their skills right at a young age. Instead of pressurizing, thwarting, or putting on your own dreams, your unfulfilled desires, aspirations, probably from your childhood, probably from your mother and father, probably from your youth that you could not achieve. Instead of thinking of the child as an extension to yourself, as an extension to your dreams, look at the child as a unique being that has come through you and not from you. And as a result of which, look at what the child possesses right in the very beginning. If the child likes to watch magic shows and wants to do magic as a small child, maybe he truly believes in the expansive nature of the world. If he likes painting, instead of taking him away from painting just because he's a boy and putting him in football, you pay attention to the fact that he has such good understanding of color, right? So observe your child, please. You will see that the child displays all their magical abilities right from the very beginning. Do not kill it by putting on and thwarting your dreams on it.
Hmm. So,
Yeah,
like you said, there's a lot of, gender stereotyping. Like if a guy is, if a male child is good at cooking, so, if they want to
yeah,
be a chef in future, pressurized not to. Or if a female child is good at, say,
yeah,
martial arts, so they would be pressured into being more homely and more girly and not practice something that is considered manly. So,
yeah.
don't you think that often happens, especially in India as well?
Yeah, yeah, it happens. I would say not just in India, but there are many other countries that happens. And well, I think we are in 2021. We still haven't been able to move out and expand ourselves beyond the stereotypes. And I agree that it's going to take time. Thousands of years have gone into determining heteronormativity and these strict categories of how a man should be and how a woman should be, and as if there is no other thing in between. So, so I believe that it's going to take some time, and it affects. But then again, we also see quite a few people making um, choices that do not fall under this strict categorization, and we
Yeah.
have a lot of people breaking these stereotypes now, and they are doing great. They are doing really, really well.
Yeah, right. Like for recent example, we have Assam's Lavlina Borgohain who won a
Yeah,
bronze medal at the Olympics, and
right,
many female
absolutely.
like well in the Olympics this time there were many, especially from the Northeast as well. There are a lot of players who went out there did so well, and it feels so good to see all this player. Mirabai Chanu from Manipur, she also went
Absolutely.
to the
Yeah.
Olympics. Don't you think so? It's slowly changing the pace. What used to be a few years ago, it's not happening anymore. Females are women are breaking the
Yeah.
stereotype, going to international platform.
Yes, yes, I do feel, and that's why I said that it's changing slowly. And we are seeing transformations now, and we are able to move beyond this stereotyping, and people are also able to accept that this is how it is, and it's going to change.
Okay. Okay. So while talking, if moving to another topic of drug abuse, why do you think there are a lot of people from the Northeast, especially youngsters, who are exposed to illicit drug menace? So how do you think we can prevent this drug abuse of youngsters?
Yeah, that's a very good question, Debashri. I'm thankful that you asked me this question. My majority of my work is around addiction, and I strongly do not look at addiction from a behavioral standpoint. I don't think that it's about the substance. One could be addicted to alcohol. One could be addicted to heroin. One could be addicted to TV, television, digital media. One could be addicted to food. The substance or the object of addiction is not of so much of importance to me as much as is the reason behind addiction. So a lot of people, these rehabilitation centers, as well as in allopathic medicine, we look at addiction from a behavioral standpoint. We want to curb that behavior, stop the behavior, and we want to control, take away the substance. It is not going to help, because all people who go through addiction always have an inner void, an inner gap, an inner hole, and this void that they try to fill up. It's like consider a bowl made of glass with a hole at the bottom of the glass, and you keep on pouring sugar in it, and the sugar is going to slip away through the gap. That's what happens in addiction, that there is a void inside people that they're trying to fill up with all of that, but it's not going to get filled up, because the void is always a result of trauma, whether it's childhood trauma, whether it's intergenerational trauma, whether it's trauma in the mother's womb, whether it's trauma in adolescence. It is always a result of trauma. So we have to look at addiction from a trauma-informed lens, which most of us don't do, because we look at it behaviorally. So I would always tell people to look behind for the reason. What is this addictive? How did this addictive personality came into being? What kind of traumas exist in the childhood or in the intergenerational line of all these people who go through all of that?
Okay. And how do you think trauma affects relationship, and is there a way to heal from trauma?
Absolutely. I'm so glad that now we have more and more people working with clients and patients, not only from a behavioral perspective, but also from a trauma perspective. That is the reason why we need to do a regression. We need to go back in time and locate at what time, around what age was the trauma there, because it depends. There are certain ages where the brain is not fully developed, as a result of which the trauma is way more effective than the time when the brain is developed. So there's a lot on trauma, but slowly people are becoming more and more aware.
Okay. And Gaurav, we have our audience comments section coming up. Somebody has commented. I'd request our technical crew to show the comment. Okay, so Vikram Nangom has commented, how do we handle mid-career crisis?
Okay. By mid-career, what might he mean? As in, you are working and in the middle of, let's say, spending 10 years in a certain field, you feel that there is what to do next. Is that what he means?
Maybe, because like in our 20s, we go through quarter life crisis, then we go through life crisis. So at the point where you decide whether you want kids or about your career decisions.
Right. Mid-career crisis is often midlife crisis. So why do we call it midlife? We call it midlife because when we are growing up till the age of 10, we are in the arms and the home of our mom and dad. During our 20s, we are pursuing and going forward for our education. By the time we turn 30, we are slowly stabilizing in our job. By the time we are 35, probably we just got married and had children. By the time we reach 38 or 39, what happens is all these drives of career, of romance, of marriage, of children, all these drives that drive the human life stops. And that is
Yeah.
when the human life really comes into its original form, because there is nothing else to drive for. That's when
Yeah.
most people have midlife crisis. And they do have midlife crisis because all the old traumas that they have had in childhood, which they did not have all the time to resolve, because all this time there were these drives, shows up.
Hmm.
So this famous psychiatrist who used to work with Freud, Carl Jung, said that when you enter 40, you enter the dark night of the soul, which means all the traumas that you experienced in your childhood from your family, they start showing up because there are no subconscious drives now to drive you towards life. So how to handle that is to, of course, seek therapy and figure out what is creating this void in your life.
Okay.
And maybe that is your opportunity. Think of it as an opportunity instead of crisis, to look back into your childhood, to look back into your generational line, to your family, and you'll find the
Yeah.
answer there.
Right. And I would like to thank Bikram Nangong for his question. And, I'd also like to request our technical team to, like, when we were going through your social media profile, we saw many videos of yours in gym, and from that, we guess more or less that you're a fitness enthusiast. Yes. So
Yeah.
I'd like to request the technical team of one of your videos where you're seen working out. So, would you say you're a fitness enthusiast?
I do, and there is a reason why that is so. Because uh, I want the audience to know that all the difficulties that we go through in our primary years of life, the pain, the suffering, the trauma, let's say the bullying, the shaming, or
Yeah.
someone screaming at us, or maybe, we not receiving enough love, or maybe our parents being extremely angry to us, right? Or we being physically abused or mentally abused. All kinds of traumas that we go through in our life are stored in our body. It's not stored in our brain or in our mind. It is body memory. And when I work with clients, I work with them by releasing these traumatic experiences via the body and very less with the mind. So my work is mostly called somatic trauma resolution, because I work with soma, which means the body. So when I'm working out, I feel uh, not only most uplifted, but the fact that I know I'm working with my body on an everyday basis and working on my trauma, it's like therapy for me. So I combine these two things: body work, somatic awareness, and fitness and exercise. And I use it for myself before I give it to my clients or patients.
Okay, so we most people. Yeah, that was a great video. So you go to the gym regularly?
I do every single day.
It's so great. Like it takes a lot of motivation. Like I think of doing exercise every time, and then I'm like, oh, okay, it's too much of hard work. It aches every time I start and then do it for a few days and then stop, and then my body aches like hell. It's really hard working. It takes a lot of motivation actually. Shout out to all the people
Exactly.
who are exercise regularly. That's so great. But uh, one thing that we have seen this past few years is people do exercise, right? And they maintain a healthy
Mm.
lifestyle, go to the gym or
Yeah.
exercise at home, yoga.
Yeah.
But the few of these people later in life, they suffer from heart diseases or go through heart attacks. Can you explain why that happens?
Yeah. Yeah. So a lot of people who come to me with, as you said in the very beginning of my introduction, that I work with psychosomatic issues, which means I work with autoimmune diseases like, let's say, hyperthyroidism, hypothyroidism, or polycystic ovarian disease. And people tell me that how are you going to work with me without giving me medication? And it goes, I take a long time to explain them that their emotions that they experience on an everyday basis affects their body's physiology, affects their nervous system, affects their blood, affects the working of their organs. And this is what the point I'm coming to, that all of us, we don't give importance to the fact that we may have anger issues, that we continuously feel low, or, the emotional coping mechanisms that we have. We don't have healthy coping mechanisms because our emotions and our past traumas and past coping mechanisms continue to remain in our body, affecting our physiology, affecting our nervous system. And they don't go away. They are not going to go away just by working out or eating healthy. We have to be mindful of these emotions and take time to process them. And at some point, these coping mechanisms collapse. They can't go on forever. So, and therefore, the body is affected by the emotional landscape of the person, which is, of course, it's going up, going down, going up, going down. Maybe that's how their emotions work. Just because they are exercising and eating healthy doesn't mean that they have a stable emotional landscape.
Okay, and do you think there is a correlation between stress and heart attacks? And is there a way to manage stress?
Yeah, of course. Of course, one of the easiest way is mindfulness.
Yeah.
Another way, well, mindfulness and meditation are almost similar, but yes, mindfulness is quite popular now. A lot of people are talking about it, and it is a practice. So people should be mindful. They should practice mindfulness by contributing some time to daily meditation. They should contribute some time to daily journaling, writing their experiences on a daily basis, how they feel, what they felt, because people are not in touch with their feelings. They're in touch with their thoughts, but not with their feelings. So one should write how they have felt throughout the day, processing out their resentment, processing out their everyday frustration, processing out their everyday anger. These small things done for 5 minutes, 10 minutes go a long way actually to mitigate stress.
Okay, so meditating and writing, maintaining a diary. So
A
keeping a
journal,
note.
yeah,
Yeah, right.
right. Breathing exercises,
Okay.
yeah,
And coming to let's coming to 2020. It was a disastrous year for people all over the world, and COVID-19 took everybody by shock. Nobody knew what
yeah,
most of the people know what a pandemic was at first, and that COVID-19 came out of nowhere, and millions lost their life during the pandemic and lost their dear ones, lost their families,
mhm,
and they stayed during the lockdown period. A lot of people were locked inside their homes, couldn't go out,
yeah,
and in between that process, they developed anxiety and depression.
mhm,
So, what would be a message to people who are recovering from post-COVID
yeah.
depression and anxiety?
Yeah, I fortunately I did quite a few sessions and lives on this and how to deal with post COVID and post COVID anxiety and depression. So once again, these are long drawn traumas that people have experienced. It's collective trauma. Every single person in the world has experienced, as a result of which we can not only feel their experiences, but we know that we are a part of this huge collective. So it's going to take time for people to process all of these experiences and emotions. People need to give time. People need to take time to slowly readjust their environment. And that is why I say that all the traumas that you have experienced as a result of being restricted, homebound, isolated, is also there in your body. So you have to do body based practices. For example, exercise, for example, yoga. You have to give your, change this term, social distancing, to physical distancing. We are not socially distanced. You and I are talking to each other right now, right? So we are not actually socially distant. We are physically distanced. As a result of which, we must also remember that we are still connected to our friends. We are still connected to our parents, our loved ones. Emotional bonding is one of the primary health markers of a stable emotional landscape. So we have to remember that. Um, we also have to know that we that we can't control what has happened. So instead of trying to control what is going to happen if it is uncertain, we also have to practice living in the moment. And what helps us living in the moment and living in the now is once again mindfulness, which is to be aware of your breath, how it goes in and how it goes out, right?
Yeah.
So my suggestion to all people would be to develop body-based practices which will allow them to be in the now, to be in the here and now, instead of constantly imagining how dreadful the future can be, right? Because the more we give ourselves into this uncertain, dreadful future, the more we will constantly be preparing. Our bodies will constantly be trying to prevent the threat, the unsafe zone that we might be entering. So we also have to practice being in the here and now. And I believe body-based practices, mindfulness, breathing exercises allows us to break free of those restrictions and remain in the here and now.
Okay. And what do you think needs to be done about the lack of awareness about mental health well-being and psychiatric help at the rural parts of Northeast? Not just the rural parts of Northeast, but there are rural parts of all of our nation, of the all
Yeah.
of India.
I believe it's already happening slowly and steadily. Many of my colleagues back in Northeast, they are truly doing fabulous work by educating, by holding more and more seminars. Now we have webinars, of course, and people can join. A lot of people can join webinars instead of having a fixed number of people in seminars because it's a physical one. So I believe that one of the things that has that, let's say, because we were talking about COVID, one of the things that being in the pandemic has also taught us is how far technology can go. And now technology has gone and positively infiltrated even the rural parts. Everyone has a phone. Everyone knows how to attend lessons or how to attend classes via phone. So we truly need to exercise and use the power of technology and reach out to as many people as we can by holding more and more presentations, more and more webinars, more and more awareness talks about mental health and emotional health.
Okay, and how do you think past life regression, sorry, past life regression therapy actually helps from a therapeutic standpoint?
Yeah, this is a very interesting question. I love past life regression therapy. So when I talk about past life, I'm not concerned whether it truly exists for the person, whether I need a validation for its existence, whether it's a theoretical concept, whether it's a philosophical concept. It does not matter to me. What matters to me is when the client, with their eyes closed, goes back to a time which they do not remember, but they are describing, because that is the time where that trauma is located. So some people slip into these memories, experiences, imaginations, when we try to dig into the past where the trauma is located. And these experiences do not belong to the current life of the person. And when they go there, resolve it, release it, and go through adequate amount of, let's say, crying and physical release and catharsis, and finally when they come out of it, the ailment or the issue is resolved, it's gone. So then we don't try to seek validation whether was it real, was it not real, when did it happen, when did it not happen. The point is the client is cured. So yes, people do slip back to memories which do not belong to their present lifetime. And Dr. Brian Weiss has written about it, and of course he's well known all over the world on past life regression therapy, and how he has worked with several clients, regressing them to different past life experiences and healing even great diseases like cancer and autoimmune issues.
Yeah. You
Yeah,
have also worked with cancer patients, right?
yes, I have. Yeah,
How's
I
that
have.
been?
Yes.
Like, is it really
Sorry, I didn't get
difficult?
your question. Yeah,
Yeah, no, I was asking that you have, okay, let's cut that question short. We have another question coming up from
yeah,
one of our audience. I'd like to see that question. It's from Zavid Bonaparte. He wrote that I'm addicted to chewing tobacco products. Suggest to get out of this addiction. Okay, he wants a suggestion of, he wants help
yeah,
to get out of addiction.
yeah. Every addiction has three components to it. The first component is a trigger. So first, ask yourself what triggers you to chew tobacco. Is it because you are in the company of friends? Is it because you are stressed? Is it because you are bored and you suddenly want to go out and chew tobacco? First is a trigger. Secondly, how do you feel when you chew tobacco? Do you feel exhilarated? Do you feel great in your body? Do you feel some kind of happiness? What do you feel? Ask yourself, and can something else bring that feeling for you? Can we replace that by watching TV, or let's say reading a book, or let's say ch- chewing a chewing gum instead of a tobacco? Okay, and non-sweetened, by the way. And lastly is the reward that you get by chewing tobacco. What is the reward that you get? Do you get to spend more time with your friends because they are also chewing tobacco? Do you get some off time because now that you're chewing tobacco, you don't have to go back to work? So check your reward. What is the reward that you are getting? And
Hmm.
try to give yourself that reward by doing something else instead of tobacco. So three things: trigger, what triggers you; second, how do you feel about it, and try to get that feeling from something else; and the third is the reward. What is the reward you are getting, and give yourself that reward before you go ahead with chewing tobacco.
Okay, so there's another comment from Shruti, one Shruti Tibrewal. She writes, somatic awareness and body work is definitely the future of trauma resolution therapy, and blessed to have esteemed experts like you, Dr. Gaurav. That's so nice of her.
Thank you.
Thank you for the comment,
Thank you,
Shruti.
Shruti.
Yeah, like I was asking earlier, we see a lot of people these days going to the gym or doing yoga at home, but
Yeah,
they face that later in life. And you explained how there should be, like we should be maintaining a diary and everything, and doing yoga on a regular basis goes a long way, right? And so I would like to quote something that you said during one of the events, and it goes as, you can be so many things at one given point of time. What does that mean?
yeah,
That sounds
yeah,
really nice.
yeah, yeah. So all of us believe in the idea of a single identity. I am a doctor.
Hmm.
I can't be anything
Right.
else. Now, the image of
Hmm.
a doctor is this person who wears, let's say, a navy blue shirt with a white tie, and there's a stethoscope hanging, and then there's a terry cotton pant that you are wearing, and then there is black shoes. But um, what if I want to be something else, right? Some other day,
Right.
like I'm working out in a gym. So some people ask me, but then, you don't look like a doctor. And I ask them, what does a doctor look like actually? For it, it's like that, right? So my point is that a human being comes into this world to experience life in its wholeness, in its fullness. Why should we restrict ourselves to having just one idea of who we are, right? Why
Hmm.
should your profession, why should your relationship to your spouse, why should the amount of money you have, why should the position that you have in the world should determine who you truly are? You can be several things, right? You can be
Right.
an independent woman. At the same time, you can be a life-saving doctor. Maybe you are also a dancer, and maybe you like stargazing at night, and maybe you are also a writer because you love art, right?
Right.
So we have these strict brackets of who we need to be in order for the world to accept us and validate us. And that needs to be broken because we are multidimensional beings. We are multitudes of personalities. We can be so many people at one given moment of time. Why should we restrict ourselves to just one identity?
We should surely use this line in a movie. It sounds so nice. And Yeah, it feels great to know that we are not limited to something like one person can suppose be a woman for suppose can be a mother, can be a businesswoman, can be
Yeah,
a player or a sports person, a lot of things all at once.
absolutely.
Yeah,
Absolutely.
that is, of course, that surely feels great. And uh, in also inherited family trauma is something that you have emphasized upon in many of your social media posts. Like you have
Yeah.
mentioned that what ancestors, the painful or traumatic experiences that our
Yeah.
ancestors have gone through, we also experience that. So, like, how does that happen? And is it true, like, what all painful experiences they went through, we also go through that?
So in Mount Sinai Hospital in New York, Dr. Rachel Yehuda, who happens to be the head of the trauma department, and she also is a psychiatrist, did a study some time back, and she found out that the second generation survivors of the Holocaust have
Right.
lesser levels of cortisol in their bloodstream. Cortisol is the hormone which manages stress.
Okay.
Now, when you look at their generational line, you see that the Holocaust survivors um, had to go through a lot of stress. Imagine all the time they were under threat, they were unsafe. There could be people not only killing them, but looting them and doing all sorts of things. So during the Holocaust, um, all of these people who were under this constant, um, you know, pull of threat, constant pull of anxiety, had used up all their cortisol levels because that's how you manage stress. And therefore, by the time it comes to second generation, the entire pool of cortisol is now less in the second generation survivors. So this is one of the scientific studies. Many such scientific studies revealed to us that our genes are affected, our gene expression is affected by the environment we grow in. Our gene expression is affected by the environment our mother and father grew in, because from the mother comes 50% of the genes of the DNA, and from the father comes 50% of the DNA. And that DNA is subject to influence, impact, and effect by whatever trauma they went through. And that trauma is passed down to us. And the field of science which deals with it now is called epigenetics. So earlier we had
Epic.
genetics, which said epigenetics, EPI.
Okay.
So earlier we had genetics which said that, okay, this is your DNA, this is your gene, and this is what you're going to be. So if you had cancer, if they had cancer, you're going to have cancer. If they had diabetes, you are going to have diabetes. But the point is that it's not written in stone. It was the environment which influenced the gene to bring up that ailment or bring up that condition or situation. So if here we look at those stories and we change the environment, our gene expression can also change. So that's a good thing, that we can change those things. So that's how inherited family trauma works in a nutshell.
So you're saying if suppose a mother, she's many of our ancestors, our grandmothers and grandfathers, they were there during the partition period of
Yeah.
the India and Pakistan partition. So they went through a very stressful time during that partition.
Hmm.
So suppose my grandmom had anxiety due to that, so it would be passed on to my mother and so on to me.
Yes, yes. Strains of that and pockets of that will be seen in our personalities, in our behaviors, maybe in our ailments. Maybe we have anxiety disorder, and we don't know why that happens. We are going on taking tablets and medication, but then we do not have a lens by which we could look into a generational line. So you are
Right.
right. Let's say if our grandmother went through um, a partition history, and
Yeah.
she saw a lot of atrocity, war, riots, and all of that. And imagine that's her body environment. That's the environment of her body, because there is stress hormones, blasting through the roof. And then she is pregnant with our mom, And mom's body is absorbing all those stress hormones from the chemical environment. So already uh, mom's eggs from where eventually we will be born are already affected. The environment that grandmom is going through is already affecting the ova that mom is carrying while she is in our grandmother's womb. So it's going to get passed down. That is true.
Okay, and Gaurav, moving on to today's youth, people are on their social media profiles all day, whether it be Facebook or Instagram or Twitter. Mostly Instagram, and a lot of youth, can be seen addicted to Facebook and Instagram. And how do you deal with this Instagram ads? We see beautiful people or people traveling, and there's a part of us that envies all that.
Yeah.
And we there are many girls, women especially, who deal with
Yeah.
body image issues due to the models or picture perfect bodies that we see on Instagram. So how do you
Yeah.
deal with patients' body image issues, and do you think social media is the cause behind half of the body image, low self-esteem issues that youngsters face today?
See, body image issue is never actually about the body. It's about how we view our body. And we haven't been taught to view our bodies positively from a very young age, right? For example, how girls are told to have a specific kind of body. Even boys are motivated to be completely be detached from their bodies, or to develop a body just because they want to impress someone else. So what I'm trying to tell you is that when we have body image issues, it is not about the body. It's about our own sense of self-worth. And our inherent sense of self-worth cannot be changed by eating less, by developing an anorexic body, or by, let's say, working out and developing muscles. Because the inherent sense of self-worth, if it's low, it's going to remain low, right? So social media is a trigger, I would say. It's not the cause. The cause is in the childhood, because our primary sense of who we are, how much we are loved, how much we are wanted, how well we are validated by our parents, and our importance in our family and our importance to ourselves is determined in our childhood. So body is a projection of that. Body is not the cause. Body is not the source of that problem, I would say.
Okay, and this year was the third anniversary of the Section 377 verdict that decriminalizes gay relationships. And you have been advocating and have been very vocal about LGBT rights. Do you face any criticism for that? Because the LGBTQ community, we see many cases of discrimination till date against them.
Yeah, yeah. It is true. It is true. It continues to phase, and maybe it's again going to phase for quite some time, because, as I said, that heteronormativity and heterosexuality has laid the ground for how people must engage, interact, reproduce, be there in the society for a very, very long time. So, for a new way and for this inclusion to develop, I believe it's going to take some time. That's number one. And number two, as a professional, I don't face criticism. I truly believe that I live in the company of people, and a world where people are extremely appreciative of the work that I'm trying to do. And I always have an inclusionary approach. But yes, as a young individual, while I tried to advocate as much as I could, I did face criticism back then. But right now, as a professional, I don't.
Okay, and do you think northeastern states can strike a balance between economic growth versus being truly happy states like our neighboring state, country of Bhutan?
Okay. Sorry, I didn't get that question properly.
I said, like northeastern states strike a balance between
Mhm.
being economic growth versus being truly happy states like our neighboring country of Bhutan?
Oh yes, 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 definitely. I think what creates the conflict is the either or situation. For example, we feel that okay, if we strive towards economic growth, we can't be happy. And if we strive towards gaining happiness and having inner satisfaction and inner harmony in human life, then we cannot move towards economic growth or money. And but then both are possible. I believe that we have a very polarized opinion towards, let's say, money, finances, and economic growth, and feel that money is the root of all evil. And and that myth needs to be broken, because both of them are possible. Even in my life, I do not function from an either or perspective. If this is possible, this is not possible. If that is possible, this is not possible. Both of them are possible, and we can of course have a happiness index to our to Northeast as well, very much like our neighboring countries.
What's your secret to happiness?
My secret to happiness is I live in the moment. I live for today. I live for this particular moment. And the second is to be in a constant state of gratitude. Every single night when I write my own journal, I thank for 25 things that have happened positively in my life. Even if it means having a splendid cup of tea in the morning, I'm still going to write down, thank you for this beautiful cup of tea. And when we are in a constant state of gratitude, we open up our bodies, we open up our emotional landscape. We can look at the world from a lens of how much the world loves us and how much we are wanted. We are not acts of accident, that we have just come into this world as an accident. No, a lot has gone into the making of the universe for us to be here. And I not only acknowledge that, but also pay gratitude to it every single day.
Okay, and research has shown that, like, I have been covering a lot of topics here, and research has shown that a disturbed childhood, or children who are bullies or victim of bullying, are at a risk of criminality in adolescence. What's your take on that?
Yeah, I think that's what I said, that, in childhood, we can be subjected to all kinds of grave happenings, all kinds of traumas, shaming, bullying, maybe having a dysfunctional family that shouts and screams every single day. And people cope differently to it. Some people simply withdraw into their own shell. Some people will sink into depression. Some people will become simply hyper aware and hyper vigilant and become anxious personalities. And some others will probably cope by perpetrating all the abuse that they went through, which is by becoming criminals. So when we are looking at people who have criminal record or acts, I would really want to look into their upbringing and, as children, what kind of traumas that they went through, because for their personalities to become dysfunctional and deviated, they certainly must have gone through something.
Okay. And like we talked about earlier, like 2020 was a gloomy year for everybody, and everybody was, praying for it to end. But one of the biggest shock that came to us in India, especially, was the suicide of popular Bollywood actor Sushant Singh Rajput. And not only him, the suicide rates in India are increasing rapidly. What do you think is the reason behind that?
Yeah, I think I've covered this, and that is because we as people living in 2020, 2021, we do not have access to our inner feelings. We don't. If I ask someone, how are you feeling right now? The person is going to tell me, oh, I think this is what happened and this is how I felt, and that this happened and that happened. But the person is not going to tell me, I feel angry, I feel sad, or I feel frustrated. So people are very much in touch with their thoughts, but they are not in touch with their feelings. As a result of which, they are disconnected and cut off from their inner world. And people will have different ways to cope with it, as I said. It could be via social media, it could be via smoking, it could be via alcohol, it could be via sex, it could be anything. As a result of which, our emotional landscape continues to affect our bodies, our mindset, our belief systems, our point of views about ourselves, and most importantly, our self-esteem and self-worth. And that creates a huge inner void, even in people who might be successful, even in people who have everything in life. And that takes us back to the first question that we received about midlife crisis or mid-career crisis, because then people do not have a solution to resolve their void. And sadly, many people do fall into this void and may end up taking their own life. So that's my take.
No, like I just, my question was like people often ask for help, they want to, but they're scared of asking for help because they often shut down or uh, people are, or no, most people in the society are not, they do not show apathy towards mental health. So what do you think, what can we do tackle the stigma towards mental health?
Yeah, I think the only way we can, tackle this is creating more and more awareness, talking more about it, treating mental health as equally as physical health. If someone wants to take a leave, so let's say they are going through an anxiety episode, they should be granted that leave from work instead of um, asking them, or instead of, let's say, assuming that they have a physical issue or not. For example, if someone has a stomach ache, they will be immediately granted leave because, of course, they cannot function at that moment. Similarly, a person who goes through a mental health crisis also cannot function. We need to have more compassionate um, um, work environment, more compassionate, let's say, senior managers. We need to have more compassionate doctors and surgeons who, again, understand the patient's problems also from a mental health perspective, not just because they're anxious before the surgery, so put an anesthesia and put them down on the table. No, we all professionals from all fields need to have more compassion towards understanding people from a mental health standpoint as much as you would understand from a physical health standpoint.
Yeah, so
And
you're
that can
saying,
come only by awareness.
you're right. So, like you said, mostly when we want to leave from our office or school, we have to give a reason that we are suffering from fever or, say, stomach ache. That those are the most common reasons. But
Yeah,
if
yeah,
someone to go and say that no, they are feeling anxious or they are not, they are not feeling it or
yeah,
are nervous, getting really anxious or are in the verge of a panic attack, they should be
yeah,
given priority
yeah,
too,
yeah,
right?
absolutely. Yeah. And for
Yeah,
that, we need these awareness programs for all professionals, especially people who are, you know, um, sitting at the helm of um, uh, all work. For example, let's say the principals of all schools, so that they can go and educate their teachers. For example, the senior managers of a company, so that they can go and talk to their employees. So people who are sitting at the helm of their respective fields need more awareness.
also, don't you think this should be, awareness about mental health should be spread in schools too? Like children, I know for like children can be really mean sometimes because, you know, at school we see these bullies, but once we become an
Yeah,
adult, we realize what we did back then was wrong. This shouldn't have been done. And almost, five out of or seven out of 10 kids, let's say, were victims of bullying. So don't you think we
yeah,
should start at or prior level at the beginning, just at the beginning of everything at school, we should
absolutely.
learn to be towards one another.
Absolutely. Children are the traffic lights of a family. They are the mirrors of a family. So, whatever a child is um, expressing, acting out, um, uh, everything that the child is doing, the child is learning from the family, right? So, which means that we need to not only teach children healthier coping mechanisms, but also teach the parents of those children that they are reflecting what they are absorbing consciously and unconsciously from you. So we do need more and more awareness and, of course, better coping strategies for children, and also more and more awareness for their parents and the teachers who are dealing with them.
Okay. Yeah. And lastly, that it was, what would be your message, for our viewers watching us live, for a message for a truly balanced life, both physically and emotionally?
Yeah, I would say live one day at a time. Invest in yourself. Um, Try not to think about how you will be 10 years down the line, how your life is going to be 15 years down the line, um, how much you need to save in order to reach XYZ position by the time you are 50. What happens is when you begin to live in the future, you also forget to live in the here and now. You can live in the here and now by completely being aware of yourself, by eating the food that you like, by watching the movies that you want, by reading the books that you like at this moment. What are the things that you would like to do right now instead of thinking tomorrow or 10 years later, I would like to have a house like this, I would like to have a car like this? Be in the here and now first. Learn to do that. It's good to imagine about the future and plan about the future, but most people do not plan or foresee it from a space of feeling safe here. Safety is um, is the basis of human thriving, human blooming. Give yourself that safe space. And you can give yourself that safe space by telling yourself that right now, I love myself. Right now, I'm okay. Right now, I am liking my life. Right now, everything that is happening in my life is great. And even if it is not great, I know it's going to be great. So, being in the moment, living in the here and now, expressing gratitude for everything that you already have, and um, not projecting ourselves too much into the future is going to offer us a safe space. And of course, investing on our own self instead of thinking what needs to happen 20 years down the line or 10 years down the line. Invest on yourself at this moment.
Right. That was such a great message. I'm sure our viewers would take away a lot from this session. It was like a personal counseling session for me as well. It was so great to have you on the show, Dr. Gaurav Deka, and
Thank
we would
you.
like to have you again on the show in the future if possible. And thank you so much for being here with us today. It was a great honor, and like, thank you so much. It feels so great to, have you on the show, and you taught us a lot of things during this 1 hour period. It was really nice. Thank you so much.
Thank you. Thank you, Devoshri. And thank you to the entire team of Northeast Today. And I'm really glad I could come here and talk to all people. And I enjoyed answering the questions. Thank you so much, then.
Bye.
Okay.
Dr. Gaurav Deka is a medical doctor, a psychodynamic psychotherapist, trauma resolution expert, a family constellation facilitator, and a transpersonal regression expert. Dr. Deka, who currently lives and practices in New Delhi, was born and raised in Guwahati, Assam, from the northeast part of India. He holds a bachelor's degree in medicine (MBBS) from Guwahati Medical College and Hospital, Masters in Psychodynamic Psychotherapy from Boston University, US, to postgraduate diplomas in Transpersonal Regression Therapy and Inner Child Integration Therapy, respectively. Dr. Deka works with several issues that young people and adults deal with today, like addiction, depression, generalized anxiety disorder, fear and phobia, stress disorders, allergies, neuroses, relationship issues, sexuality and orientation issues, and psychosomatic ailments. He also works with patients suffering from cancer, autoimmune diseases like hypothyroidism, diabetes mellitus, chronic kidney diseases, osteoarthritis, fibromyalgia, unexplained somatic pain, etc. Not only this, but Dr. Deka has also been very vocal about fighting for the rights of the LGBT community. He has extensively emphasized the importance of LGBT mental health and helped several patients and clients from the community with coming out. Dr. Deka has also attended TEDx and TEDx CVS events where he talked about how believing in a single identity doesn't allow us to be anything apart from what we make ourselves believe we are, and hence people never end up living the life they want to live. He believes one should first decide what kind of life he or she wants, and then once that is decided, one can very well figure out what are their identities what one can pursue in order to have that life. In another event, he emphasized the illusion of choice and how choice exists because of options and how conflict in turn arises out of options. According to him, conflict is an omnipresent phenomenon playing a catalytic role in every decision a person makes.